Hi everyone, I'm Errol Weiss. I'm Health-ISAC's Chief Security Officer, and I'm joined here today with Phil Englert, who is the Director of Medical Device Security for Health-ISAC. We're here today in recognition of Cybersecurity Awareness Month. So, Phil, it seems that Google, Apple, Amazon, they're all everywhere. And on top of that, they're at the foundational level of wearable technology. And there's so many cool advances in the technology right now, and even more coming that will help us, people like you and me, take more control of our own healthcare. So, can you talk a bit about that and what security and privacy concerns that we as actual individuals might have?
Sure, Errol. So, you pointed at a thing with Google and Microsoft. Digital health is expanding at a phenomenal rate, right? And devices, the wearable devices are at the heart of it. And they come in a variety of names, right? We call them fitness trackers or health trackers, and some of them are even medical devices, right? But at the root of it all, they're all biosensors. And biosensor is a device that has a physiochemical detector used to measure the concentration of a chemical, right? And biosensors are not new. They've been around. They were invented in 1956 by a gentleman by the name of Leland Clark. And today's sensor technology has expanded to include optoelectrical, pressure, and accelerometers. And biosensors are really cool. They can measure temperature, heart rate, even heart rhythm, blood pressure. They can detect falls, and they have specific biochemical markers, such as glucose for monitoring diabetes or sweat chlorides for monitoring cystic fibrosis. They can also come in a number of form factors. They can be wrist mounted like watches, or chest or head mounted, skin adhesion patches, or even gloves or other smart clothing. And the incredible thing is, two or more types of sensors may be present on a single device. An example of this is the Apple Watch. The ECG is a medical device regulated by the FDA, but the accelerometer used for fall detection, the step and activity trackers are not medical devices on the very same devices. And we look at nanotechnologies. We're going to expect these to expand the diagnostic, monitoring, and therapeutic capabilities to bring even more benefits to patients and caregivers. And healthcare is migrating away from the acute care setting and becoming more remote, right? And more patient and consumer centric. And the lines between these consumer devices and medical devices will continue to blur. And all of these devices at the heart of healthcare generate data. And it's your data. And it's transported and consumed by a variety of people, a variety of enterprises for a variety of reasons. And your personal data is worth protecting. More and more, many health, fitness, and increasingly personal medical devices also use our phones to collect and relay this data. And the amazing, well, not the amazing thing, but one of the things, is it's not just bad actors we have to worry about getting into our phones, right? Keep in mind, you're more likely to lose your phone than to have it stolen, right? So with that in mind, just a few simple things, right? Lock your phone with a password or fingerprint detection or face recognition. Use multi-factor authentication wherever possible, right? If it's not already the default on your phone, consider encrypting the data, right? And set up a remote wipe. So if you lose it, you can kill the data before somebody can access it, right? And back up your phone. This is important data, right? It's worth it. It's often all pictures, contacts, right? And now medical data. So back it up, right? And update your operating systems often. And I think these things can help bridge that transition from medical device to consumer device.
Yeah, that's great advice. I know it's so prevalent out there. People are really concerned about where that data ends up and who has access to it. So, protecting it, like you mentioned, is great advice. You mentioned multi-factor, two-factor authentication. I'll put a couple of links in the video description about where you can go to turn that on for things like Google and Microsoft and Apple as well. So I'll provide those.
Excellent. Thanks, Errol.
All right, great, Phil. Thank you.
You
And
bet.
thanks for
Thank
tuning
you.
in.